Hi, it's Michał with Rampol Coaching. I would like to talk about mobility since that's the area I notice is becoming biggest roadblock for most people in their fitness journey. So I will just show you quick assessments you can do yourself. So it's a self-assessment with quick solutions how to fix the joints that I notice are most restricted or areas of your bodies. So it's going to be really easy. And the whole idea of this channel is keeping things simple so you can do it at home without fancy equipment and without a lot of knowledge, just following exactly step by step what I'm going to show you here. How would I see if my ankle needs some work? I usually do a test at the wall where you get your toe against the wall and drive your knee towards the wall and keeping your heel down, trying to move farther away until you get to that sticking point where your heels is coming up. I will consider anywhere from 3 to 5 inches away from the wall as a good range of motion in your ankle. What you're looking for is keeping your foot pointing at 12 o'clock, because a lot of times I see people doing that drill, the foot is turned out, it looks like that. So that's actually not the pattern we're looking for. We're looking for nice knee tracking, over toes, passing, going towards the wall. So keep it honest, make sure you don't turn out your foot and that your heel is not coming up. Once you figure out where that sticking point is, where you cannot maintain your heel, you will take the measurement. So just take a tape and just measure the distance. Same for the other leg. So it's very important to do on both sides, since I notice a lot of clients have an asymmetry between left and right, and that goes along with pains, especially in the lower back, sacroiliac joint, because they have asymmetry, and asymmetry is a leading cause of injuries, or I would say one of the definitely top 3 leading causes of injury. So you want to make sure that that you have both ankles assessed. From there, you can also go for the assessment number 2, which will be just heels against the wall, trying to get your foot away from the wall while keeping your heel against. Try to fit your foot in there. If you can't do that, you find the same thing on the other side. So this is, I would say, a little bit easier way to approach it. I would prefer the first one, since you can actually exactly see the result in the number. Alright, so now we know if our ankles are restricted or not. Now time to take care of it. So since the ankle mobility, there's a tissue down here and above, so those are probably the areas where you want to focus on releasing the tension. So plantar fascia, all the calves, Achilles, all that area here. So easiest way, I would start from the bottom. So you want to probably roll your feet. For that purpose, I would suggest something smaller. As you can see, I have a whole collection of balls here. So I will start with a golf ball or something like that. It's a pet toy from my dog, so we're sharing. You can use that. This is a little softer, so if you feel like you have a lot of tension in your plantar fascia, I would probably start with something softer, or even tennis ball. The smaller the better, because there's a lot of small little areas where you want to get in. So it's pretty straightforward, just starting very gently, so you can see I'm not putting a lot of weight on that golf ball. Just try to find some tight areas. Just found something. Just want to hold it there for a little bit and then move on to the next area. As far as how long would I do it, I would suggest to approach it like any massage, where the more time you spend there, most likely you're going to see more results. So I wouldn't say there's any time limit for that. I like to use the golf ball at the time where I'm sitting anyway. So let's say if I sit down at the couch at some point in my day watching a TV or reading a book, you can just put it under your feet and roll your feet while you're sitting anyway. So, or I have some clients using it in the office, while they're in their office, they rolling their feet when they have time. So that's as far as the feet. Now we're going to move to the calf. Alright, so we move into rolling our lower leg, calves. So For that purpose, you can use any kind of a ball. Of course, the harder, the more you're gonna feel it, so I will leave it up to your discretion if it's too hard or not. My favorite tool is the Peanut because it tracks on the yoga block. You can use hardcover book for that. Anything that is gonna elevate your foot off the ground, since on the ground it's gonna be very hard because you're gonna be dragging your heels. So anything that's gonna elevate your foot will do. From there, just focus on the two sections. On the bottom part of your calf, of the lower leg, roll. Next technique is making the circles, left, right, especially if you find some tight areas, some adhesions there, dig in, and going up and down. After a while, moving on to the calf. As far as the time is the same rule applies as the plantar fascia. Try to spend at least 1 minute on there. Same thing, rolling, trying to find some tight spots. Like I can feel right now something over there. I'm gonna do some circles, left, right, and up and down. All the time, try to focus on your shoulder position. So as you can see, my shoulders are back and my hands are pointed back. So try not to be in this position because that might really wear your shoulder, causing some impingement there. So yeah, don't just focus on the calf, but also how the rest of the body, nice long spine, and just focusing also on breathing, inhaling, exhaling as you move along. All right, once we loosen up the tissue on the bottom of our feet and calves, now we gain some more range of motion, so let's take advantage of it. The easiest way is to placing a stick or dowel right in front of the pinky, and from there, you can do it either standing, make sure your hips are aligned. I like to kind of hold on to something so I keep my balance, and driving your knee outside of the stick while keeping your heel down. So this is very important, try to pay attention. I maintain my heel down. So make sure you don't lift it because then we're missing the whole point of the drill. So driving out. I like to also sometimes stretch my toe, bottom of my foot like this. That gives me a little bit more range of motion. Now a little bit more advanced. This is a small dumbbell, but you can use any kind of surface where you can elevate your toes. The idea is the same, placing dowel in front of the pinky and making sure my foot is pointing at 12 o'clock and I'm driving out. This feels definitely more intense, so if you feel brave, try this from the side very quick. Toes up, dowel in front of my pinky. Make sure the back foot doesn't turn out, so I'm square here in my hips and shoulders. I'm leaning against, because again, this is not about balance here, it's more about mobilizing my ankle. Driving in, as you can see, I'm maintaining my heel down. It feels pretty intense. Try to do this as often as you can. You will see within a week or two a lot of gains as far as you probably form. If you're squatting or running or whatever you're up to, you will notice probably that without getting stronger or faster, it will improve your movement quality. And next joint I will cover is a hip, so stay tuned. Thank you for watching. It was Michal, and I hope to see you soon.